Perseris risperidone is a long-acting injectable antipsychotic commonly used to treat schizophrenia or other mood-related conditions. Stopping it requires careful planning and professional guidance. Here's a list of 200 considerations to keep in mind before discontinuing Perseris. Medical and safety concerns. Consult your doctor before making any changes to your medication. Abruptly stopping Perseris can lead to withdrawal symptoms. You may experience a return or worsening of symptoms. Psychosis, mood swings. Your doctor may recommend tapering off oral risperidone before fully discontinuing. Monitor for signs of relapse, such as paranoia or hallucinations. Stopping suddenly can cause anxiety or agitation. Symptoms may reappear within a few weeks due to the long-acting nature of the injection. Withdrawal symptoms can include insomnia and irritability. Discontinuation may lead to mania or depressive episodes in bipolar patients. You might experience rebound psychosis, which is often more severe than prior symptoms. Monitor for physical symptoms like nausea, dizziness, or headaches. The medication remains in your system for several weeks after your last injection. Restarting treatment may be more difficult if symptoms worsen. Discuss alternative treatments such as therapy or other medications. Ensure a support system is in place during discontinuation. Gradual tapering is safer than abrupt cessation. You may need close monitoring from a psychiatrist during withdrawal. Stopping Perseris can trigger severe mood instability. Be aware of the risk of hospitalization if symptoms worsen. Withdrawal effects mimic mental health symptoms, complicating diagnosis. Consider the reason for stopping, side effects, efficacy, or personal choice. Have a relapse prevention plan in place. Inform family or caregivers about your decision to stop the medication. Antipsychotic withdrawal can affect cognitive function temporarily. Sudden discontinuation can lead to suicidal thoughts or behaviors. Discuss lifestyle changes that can support your mental health. Exercise, diet. Keep emergency contacts available in case of a crisis. Identify early warning signs of relapse specific to your condition. Long-term use changes brain chemistry, so stopping can have complex effects. Monitor your sleep patterns as withdrawal can disrupt them. Work with your doctor to evaluate if oral risperidone is needed temporarily. Some people experience restlessness or akathisia after stopping. Monitor for physical side effects like rapid heart rate or sweating. Be prepared for possible mood swings during withdrawal. You might experience difficulty concentrating or making decisions. Rebound symptoms can last longer than expected due to Perseris' extended release formula. Tapering schedules may vary depending on how long you've been taking the medication. Use a symptom journal to track changes during discontinuation. Some withdrawal symptoms may mimic anxiety or panic attacks. Gradual withdrawal can reduce the intensity of side effects. Ensure access to therapy or counseling during this time. Discuss the risks of stopping if you're pregnant or planning to become pregnant. Avoid self-medicating with alcohol or recreational drugs during withdrawal. Stopping without medical guidance increases the risk of adverse effects. Some people develop gastrointestinal issues during withdrawal. You may feel off balance or disoriented as your body adjusts. Regular check-ins with a healthcare provider are crucial. Withdrawal might worsen pre-existing conditions like anxiety or PTSD. Medication can take up to 8 weeks to fully leave your system. Have realistic expectations. Withdrawal symptoms may be unavoidable. Emotional and mental health considerations. Expect changes in mood such as irritability or sadness. You may feel brain fog as your body adjusts. Emotional hypersensitivity can occur after stopping. Journaling can help process your thoughts and track symptoms. Have a plan for managing stress during withdrawal. Some people feel an initial sense of clarity or relief when stopping. Therapy can help address any fears about discontinuation. Be patient with yourself. Adjusting may take months. Increased emotional reactivity is common. Some individuals experience a temporary increase in paranoia. Mindfulness or meditation can help manage withdrawal stress. Ensure your living environment is stable and supportive. Practice self-compassion if withdrawal feels overwhelming. Discuss potential temporary emotional instability with loved ones. Prepare for possible low energy levels. Social support can reduce feelings of isolation during withdrawal. Be prepared to face fears about living without medication. Have coping strategies for dealing with negative thoughts. Set realistic goals for managing symptoms without medication. Withdrawal can sometimes cause temporary personality changes. Mood swings may feel more intense than usual. Regular physical activity can improve emotional regulation. Discuss the impact of stopping with a mental health counselor. Family therapy can help loved ones understand your transition. Recognize that emotional numbness might return temporarily. Stopping medication may lead to increased self-awareness. Be mindful of perfectionism in handling withdrawal. Plan for periods of low motivation or productivity. Some people find it helpful to explore their spirituality during this time. Increased irritability may strain personal relationships. Take note of how stopping affects your creativity or focus. Evaluate your readiness to handle stress without medication support. Discuss with your employer if work accommodations are needed. Recognize the possibility of feeling nostalgic for the medication's stability. Consider joining a support group for individuals discontinuing antipsychotics. Understand that withdrawal emotions are often temporary. Plan for a gradual return to previous activities. Reflect on your motivations for stopping medication. Explore creative outlets for expressing difficult emotions. Develop a structured daily routine to maintain balance. Recognize that emotional instability may affect decision-making. Be prepared to experience intense dreams or nightmares. Track emotional progress alongside physical symptoms. Practice grounding exercises to manage overwhelming emotions. Be aware of the risk of loneliness during withdrawal. Allow yourself time to heal without rushing results. Stay informed about the potential for new emotional insights. Avoid making significant life changes during withdrawal. Set boundaries with others if their support feels overwhelming. Understand that withdrawal may temporarily affect your self-esteem. Physical and health adjustment. Monitor your blood pressure during the withdrawal period. Persistent headaches could indicate withdrawal-related tension or stress. Be mindful of changes in appetite, which may increase or decrease unexpectedly. Discuss potential sleep disturbances and solutions with your doctor. Ensure adequate hydration, as stopping medications can affect fluid balance. Track any signs of dizziness or fainting, especially when standing up quickly. Withdrawal may cause temperature regulation issues such as hot flashes or chills. Some individuals experience muscle stiffness or joint pain. Keep an eye on your cardiovascular health, as antipsychotic withdrawal can affect heart rate. Antipsychotic withdrawal can temporarily disrupt your immune system. Engage in regular exercise to support physical and mental health during withdrawal. Stopping medications can lead to changes in bowel habits like constipation or diarrhea. Ensure you're getting enough omega-3s and other brain-supporting nutrients. Consider supplements to support overall well-being, but only under medical advice. Evaluate any signs of hormonal changes such as irregular menstrual cycles. Be prepared for fluctuating energy levels. Physical symptoms like restlessness may be temporary but challenging. Recognize that the body needs time to adjust to the absence of the medication. Withdrawal can lead to flu-like symptoms such as fatigue and achiness. Skin issues like acne or rashes may occur as the body adjusts. Avoid overexertion as your body adjusts to being off the medication. Breathing exercises can help manage physical symptoms like palpitations. Eye strain or vision issues may temporarily worsen during withdrawal. Stay vigilant for any sudden changes in physical health and report them to a doctor. Understand that perseris withdrawal affects not just the brain but the entire body. Ensure regular physical checkups to monitor overall health. Hormonal imbalances may cause mood-related physical symptoms such as bloating. Nutritional deficiencies like low magnesium can worsen withdrawal symptoms. Prepare for temporary changes in skin sensitivity or temperature perception. Address any issues with inflammation or swelling that arise during the withdrawal process. Practice yoga or light stretching to reduce muscle tension. Identify foods or drinks that may worsen physical symptoms such as caffeine. Track any lingering sedative effects as the medication leaves your system. Prepare for potential changes in balance and coordination. Be cautious about driving if you feel dizzy or disoriented. Consider a medical bracelet or card indicating a recent medication history. Schedule follow-ups with your psychiatrist for detailed withdrawal monitoring. Report any signs of extreme fatigue to ensure it's not a more serious issue. Be patient with how your body adjusts to hormonal and neurotransmitter shifts. Take note of physical improvements or challenges to discuss with your healthcare team. Prepare for heightened sensitivity to criticism or stress during withdrawal. Seek professional counseling to discuss your emotional state during this transition. Understand that grief or sadness about stopping medication is normal. Journaling daily experiences can help you reflect on progress and setbacks. Stay connected with loved ones who provide emotional stability. Plan calming activities like reading or walking to counteract emotional distress. Attend peer support groups for individuals transitioning off antipsychotics. Expect feelings of nostalgia for the stability the medication once provided. Build a safety plan for any unexpected emotional crisis. Explore mindfulness apps or guided meditations to manage stress. Acknowledge feelings of vulnerability and work toward emotional growth. Discuss potential relationship challenges with a therapist. Reach out to a crisis hotline if you feel overwhelmed or unsafe. Allow yourself to rest when emotionally drained. Consider creative hobbies like painting or music to express emotions constructively. Be mindful of any thoughts of self-blame or inadequacy during the adjustment phase. Practice gratitude to focus on small victories during withdrawal. Avoid isolating yourself. Reach out to trusted friends or family. Monitor for signs of emotional numbness or apathy. Prepare for any feelings of loneliness during the withdrawal period. Learn grounding techniques to manage flashbacks or dissociative episodes. Accept that emotional ups and downs are a normal part of healing. Celebrate milestones such as a week or month without symptoms worsening. Reassess life goals or priorities with the help of a life coach or therapist. Seek out literature or resources from others who've successfully discontinued medication. Build self-confidence in your ability to manage your emotions independently. Avoid toxic environments or people that could worsen emotional challenges. Explore spirituality or personal belief systems for added resilience. Reflect on how far you've come in managing your mental health. Surround yourself with uplifting or motivating content such as books or podcasts. Plan small outings or trips to boost mood and reduce stress. Avoid overanalyzing emotional fluctuations are part of the process. Take time to acknowledge positive emotional changes during the transition. Discuss with the therapist how to maintain emotional stability post-medication. Build habits that promote resilience, like regular gratitude practices. Remind yourself that discomfort is temporary and part of the process. Challenge negative self-talk with affirmations or positive reframing. Take note of how your emotions evolve over weeks and months. Seek validation and supportive friends or family during moments of doubt. Focus on small, manageable changes to avoid feeling overwhelmed. Plan your withdrawal timeline during a less stressful period of life. Create a written action plan with your doctor before stopping. Identify your triggers and learn strategies to manage them. Stock up on tools for self-care such as books, aromatherapy, or art supplies. Inform your healthcare team of any changes in living or work situations. Reassess your financial situation if alternative treatments are needed. Explore non-medical treatments like acupuncture, massage, or yoga. Have an accountability partner to ensure you stay on track with your wellness plan. Avoid making major life changes such as moving during withdrawal. Schedule regular follow-ups with your psychiatrist to track progress. Ensure consistent communication with your pharmacist about any concerns. Have a backup plan in place in case of a sudden relapse. Prepare for medication reintroduction if symptoms worsen significantly. Explore holistic health options to support your overall well-being. Research community programs or resources for mental health. Keep emergency contacts readily available during the adjustment period. Avoid activities that could increase stress, such as excessive work hours. Evaluate the success of tapering strategies with your healthcare provider. Focus on long-term goals and remind yourself why you made this decision. Celebrate each step of progress, no matter how small, in your journey.